Good afternoon. Our session is about to begin in a few minutes. And while waiting for others to join, we would like to remind everyone to mute your microphones and turn on your cameras. And also, if you have any questions during the webinar proper, please leave them on our chat box as we will be allotting time at the end for the question and answer.
We also encourage everyone to stay until the end of the program. Thank you.
So, a pleasant Saturday afternoon, everyone.
Welcome to Madrasal's Medical Services webinar entitled HIV and AIDS Awareness Campaign with the theme Hear Their Stories to Break the Stigma. This event was made possible in partnership with the Wedding Suppliers Association of the Philippines, Inc. and Philippine Workshops.
But before we start, please allow us to begin by introducing ourselves. My name is Shaina May Mangawang.
And I'm Arish May Asusana, and we're your host for today's event.
Before we proceed, let us take a moment of silence for our opening prayer and singing of the Philippine national anthem.
Let us bow our heads and put ourselves in the presence of the Lord. Dear Heavenly Father, we thank you for gathering all of us today. May you bestow your guidance and blessings so that we can enjoy and appreciate its significance in our lives. Bless everyone who are present here today, that each one of us may be able to share our knowledge, understanding, and wisdom for your glory and honor. May the various activities related to this event be a success through your intervention. We all ask of this in the mighty name of Jesus. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
So, once again, hello everyone, and we're very glad that you're all here with us today, right, partner?
Yes naman partner, kaya naman would like to greet and acknowledge everyone who attended our webinar via Zoom and also our audiences who are watching live on our Facebook page. We hope you're all having a great time.
So, just to check in with you guys, please let us know how are you all feeling today by reacting heart for happy. Well, react for happy, guys. So there you have it. I hope everyone is doing great right now.
Ayan, since nakamusta na natin ang ating mga audiences partner, maybe it's time na din siguro to introduce our speakers from Team Dugong Bughaw for today.
I agree, partner. So now, without any further ado, let's introduce our first guest speaker for today's webinar. She is a graduate of BS Public Health from the University of Philippines Visayas, a registered medical technologist, a peer educator, and CBS motivator of Team Dugong Bughaw, and currently a second-year medical student at the University of the Philippines College of Medicine. Miss Cara Cazañares.
Now, for our second speaker, he is a former student government president of the University of San Agustin, a peer educator and CBS motivator of Team Dugong Bughaw, and is currently a fourth-year student taking up BS Foreign Service, Mr. Adelmar Javier Jr.
And for our third speaker, he is an advocate of HIV and AIDS, an International Youth Icon Winner awardee, and an ASEAN Youth Summit delegate, Mr. Nonoy.
Ladies and gentlemen, let us give a virtual round of applause for our speakers from Team Dugong Bughaw. All right. Good afternoon, Team Dugong Bughaw. It's a pleasure to meet all of you.
Hello, TDB. So before we proceed, may I ask how are you feeling today? Let's start with Miss Cara. How are you, ma'am?
Hello, everyone. Am I audible?
Yes, po.
Okay. So, okay naman. Excited to meet you all and share what we have in TDB with you. So, thank you very much for this opportunity.
Thank you, ma'am. It's nice to know that you're doing well, Miss Cara. And now, may I ask Sir Javier, how are you po, sir?
Hello, am I audible?
Yes, sir.
Ayun, sige. So, thank you very much everyone for inviting us. And we're so excited to share with you kung ano yung nalalaman namin sa TDB and of course, to share with you our advocacy, no? Which is to know the science and stop the stigma.
Again, so it's nice to know that you're doing great as well, sir. And for our last speaker, same question, Sir Nonoy. How are you today?
Same also to Adi and Kara. I am grateful and thankful to invite me as your speaker.
Very well, Sir Nonoy. We're all happy that you're all doing well, and we're also happy to be with all of you today.
Right, I agree with you, partners. So I guess everyone's already excited. Kaya naman, let's not waste another minute. Let's sit back, relax, and listen to Team Dugong Bughaw stories.
You may take the virtual floor.
So once again, good afternoon sa inyong lahat. Kami pala yung Team Dugong Bughaw and I'm Adi. So before we start, we'll first introduce sino ba kami as an organization, no? Ano ba yung ginagawa namin? Ano ba yung artwork namin? And of course, sana may kayat din namin kayo na to join us in this journey. So, without further ado, kami ito, Team Dugong Bughaw. So, kami ay isang non-profit youth organization na based primarily in Iloilo City. Kung kaya't yung targets namin mostly are from Iloilo City. But we are also invited in many places no, around the Philippines. And ito kami, we're also part of Ideas Positive and the Unilab Foundation. And also, nanalo kami noong 10 Accomplished Youth Organization noong 14th awarding ceremony nila. So we started our organization with these 5 people, no? So we have here Kuya Jap, Ate Ange, si Kuya Jack, si Ate Giza, saka si Ate Abby. So we started here and almost all of them actually are from the medical field. However, Ate Abby is actually not from a medical field, which is kind of like tinatanong ng karamihan. Bakit hindi ba kailangan medical field lang dapat yung ganitong advocacy? So that's actually wrong. That's actually a misconception. No, even though na I'm a foreign service student, si Ate Abby, communication student, we all have our role in this advocacy for us to share and to stop the stigma. So, sinamahan sila ng two more members. And then next, ito yung ginawa nila. From those 7 members, nag-grow sila to this many members, which actually come from different universities here in Iloilo City. So here are our 3 missions. The first mission is to unite universities and colleges within Iloilo City. Second, encourage Ilonggo youth to get tested for HIV. But not only Ilonggo youth, kasi kahit kayo nandito. So the youth din no, in Cavite and in other locations in the Philippines to get tested for HIV. And then of course, to empower people living with HIV, or tinatawag natin silang PLHIV. So apart from those 3 missions, we have also wanted to create a youth alliance against HIV and AIDS, which we have done here in Iloilo City. So sila yung partners namin here in Iloilo, CPU, North Central Philippine University, St. Paul's University Iloilo, University of San Agustin, Iloilo Doctors College, John B. Lacson Maritime University Molo, Iloilo Science and Technology University, University of the Philippines Visayas, West Visayas State University Iloilo. And of course, we also have here our partners and sponsors, no? Mano Amiga Philippines, Out of the Box, Media Literacy Initiative, Positive Youth Development Network, CPU Medical School, SKPA, and Love Yourself. We're also partners with the Department of Health, the Western Visayas Medical Center, National Youth Commission, and also the FEOP and Iloilo Social Hygiene Clinic. Okay, sorry, is my sound still muffled? Or okay lang ba? Clear naman siya? Sige, I hope
Yes,
it's
sir.
clear.
Yes, sir,
Okay,
it is.
sige. So we're also part of the city government of Iloilo, the local government of Iloilo, the province of Iloilo, and of course, the local youth development council or LYDC. And since karamihan sa amin, all of our members are actually members of the youth, no? Sana kahit pag-graduate na sila, they're still members or part of the youth. But we really started, no, with the youth because we know that change starts in you. So, yun. So thank you very much, everyone, once again for inviting us. You can contact us here on this on our Facebook page. And now we will proceed with our discussion on what is HIV and AIDS all about. Ano ba yung difference between HIV and AIDS? Is there even a difference between them? So, Ate Cara, please take the floor.
Okay, so thank you, Adi, for introducing TDB to our Med Results friends. All right, so before we start siguro, we'll just have a simple game lang. Adi, can you please share screen? Okay, so for today's event, we'll start off with a game muna. So this is called 1 versus 100. So I want you guys to participate sa ating event, sa ating activity today. So what we're going to do is we're going to ask you some questions about HIV and AIDS and the whole advocacy and see if ano yung nalalaman nyo so far. And hopefully, by the end of our event, meron kayo matutunan more and mas ma-clarify yung idea nyo about HIV and AIDS and the advocacy that comes with it. So this game is called 1 versus 100. So I'm going to ask you questions and I will give choices sa inyo. So you'll just type in the chat box later kung ano yung sagot. So example, first question. Ito, question number 1. What is the meaning of HIV? So you type in R for red, B for blue. Okay? So what is the meaning of HIV? R for red, human immunodeficiency virus, or B for human immune compromising virus. Okay? So madaming sumasagot ng letter R. So the answer is R, human immunodeficiency virus. Okay, very good. So thank you sa pagsagot. So we have a couple more questions coming our way. So next question, please. Now, What is the meaning of AIDS? So is it acquired immune deficiency syndrome or antiviral immune deficiency syndrome? So R for acquired immunodeficiency syndrome and B for antiviral immune deficiency syndrome. Okay. So again, R ulit. Sabi ni Sir John Patrick Lingahan, R ulit. Oo nga, no? Parang R lagi yung sagot. So the correct answer is acquired immune deficiency syndrome. Okay. So thank you so much. Next, please. All right. Which scenario can transmit HIV? So the first is kissing. Okay, I think this is smooching. Parang nag-smooch lang, nagpe-peck lang sa lips. So this is R for smooching or pecking sa lips. And then B for pregnancy and delivery. Okay. And also, I think the blue GIF indicates breastfeeding. Okay. So madami ding nagsagot ng B. So you are correct. Breastfeeding and pregnancy can transmit HIV. All right. So question number 4. Eto. So, this is, try to guess lang guys kung ano kung sa tingin nyo sa Western Visayas, may pinakamataas na number ng cases ng HIV. Right? Is it Iloilo Province or Iloilo City? R or B? Right? Just guess. Okay? Okay, next. What is the answer, Adi? So, Iloilo City has the highest number of cases in Western Visayas. Ayan. B, I think kasi city. Yes, probably. But dahil din ganon or siguro more access to testing yung people from the city. So we'll discuss that later. Okay, next. Question number 5. True or false? In the year 2018, scientists announced that there is already a cure for HIV. So, is this true or false? R or B? Meron daw cure for HIV since 2018. Okay? So, R, meron nagsasabing B, meron nagsasabing R. Okay? So, what is the correct answer? Meron na bang cure for HIV? So, false. As of now, wala pang cure, but there are already treatments, which I will also discuss later. Okay. So, next. How many body fluids could transmit HIV? So when we talk about body fluids, yung mga fluids na lumalabas sa katawan ng tao, such as yung mga laway, dugo, luha, ganon. So ilan? 4 or 3? Is it R or letter B? Okay, so madaming B, 3, C, sure lang? 3 lang? Char. Merong R. Okay, sabi ni Kay Loreto, 4 daw. So what is the correct answer? Okay, so 4. Tama si Ma'am Kay. 4 body fluids. Okay? So next. Could you tell if a person has HIV infection by looking at them? So pag nakakita ka ng tao, can you say na, ay, may HIV infection yan or na-infection ng HIV? Yes or no? R or B? So, madaming nagsabing letter B, sumagot ang letter B, so that's correct. So you can't really tell if a person has HIV infection just by looking at them. Okay, next. Now, question number 8. What is the terminal stage of acquiring HIV infection? What is the terminal stage daw? Ito daw yung last stage. So R for AIDS stage and B for asymptomatic stage. Ayan, madaming nagsasagot ng R. So, tama kayo guys. R for AIDS stage. So, that is the terminal stage of acquiring HIV infection. Terminal meaning yan yung last stage, end stage ng HIV infection. Okay, next please. Now, what does VCT and CBS mean? So, R for VCT means voluntary checking and testing, and CBS for community blood survey, while B is for VCT, voluntary counseling and testing, and CBS for community-based screening. Okay, so madaming sumagot ng R, but Ma'am Jezel from marketing says B. Right. So the correct answer is B. VCT means voluntary counseling and testing, and CBS for community-based screening. So next, please. This is just a way for you guys to be familiar with the terms na sinasabi namin ngayon because we will discuss them, each one of them later on. So, para na to give you a heads up na rin. Okay. Now, in December 2018, our nation has finally passed the Philippine HIV and AIDS Policy Act, which is otherwise known as R for RA 11166 and B for RA 11666. So, ang sagot is RA 11166, which is known as the Philippine HIV and AIDS Policy Act. Okay, so that's it. 10 questions lang tayo, guys. So, thank you so much for participating sa ating activity. Now, we will proceed to the presentation wherein we will explain what those terms you've encountered earlier mean, okay? Para naman na mas clear sa inyo bakit ganito, bakit gito yung sagot, bakit apat na body fluids and hindi tatlo, di ba? Bakit pregnancy can transmit HIV and smooching or kissing cannot. Okay, now, first, yung tanong, malaking tanong, is HIV equal to AIDS? So, can you type in your answers? Is HIV equal to AIDS? Say yes or no lang sa chat box. Alright, so you're actually correct, diba? HIV is not equal to AIDS. Ayan. So, why is this so? So, sabi dito, HIV and AIDS are two different medical conditions, which is right naman. HIV is the virus, human immunodeficiency virus. So, ito yung virus na nag-i-infect ng other people. So, ito yung organism na nagko-cause ng HIV infection. Now, AIDS means acquired immunodeficiency syndrome. So, this is the last stage of HIV infection that can serve as a gateway for multiple infections, ultimately leading to life-threatening situations. So basically, hindi lahat ng may HIV nagpo-progress into AIDS stage. So tandaan na HIV is human immunodeficiency virus. Human because human to human contact lang. So hindi pwedeng makuha mo sa aso, hindi pwedeng makuha mo sa baboy or anywhere, basta human lang siya. Because human immunodeficiency virus. So immunodeficiency what does this mean? Immune system. So deficiency, parang it weakens the body's defenses against disease or infection. Now, yung virus na to, yung tina-target niya, yung immune system ng tao. 'Di ba yung immune system ng tao, ito yung nagpapalakas sa atin, nagpo-protect sa atin ng from many diseases and illnesses, 'di ba? Now, this virus specifically targets the immune system para mag-weaken ito. And now, when it weakens, hindi na natin mapaprotect yung self natin from other diseases. So yun, virus, organism that reproduces itself by taking over the human cell. Okay, so clear na yan, no? Human immunodeficiency virus. Now, what is AIDS? AIDS is acquired immunodeficiency syndrome. A is acquired, meaning again, you can get it from other people, transmitted from person to person contacts. Okay. I is immunodeficiency or ID. So again, katulad ng HIV, it affects and makes the immune system not work properly. Okay? Next is syndrome. What is syndrome? So ito yung wide range of different diseases. Madami ng sakit dito, madami ng mga symptoms. So it is basically a collection of signs and symptoms. So the main takeaway here is that HIV is not equal to AIDS. HIV causes AIDS, but not everyone who has HIV could have AIDS. Okay? So we will explain that later sa presentation na ito. Now, yung tanong nyo is, okay, we know that HIV is not equal to AIDS, so what? Anong pake ko? Anong pake namin? Ganon. We usually say this to many people na sasabihin nila, yung topic of HIV and AIDS, para lang yan sa mga healthcare workers, para lang yan sa mga nurses, sa mga people that are sick, ganon. But actually, this should not be the case because everyone is involved in the HIV and AIDS na topic. Why? Because 37.7 million people are currently living with HIV and AIDS worldwide in 2020. So imagine you guys, 37.7 million. So aside from the COVID-19 pandemic, we also have an HIV pandemic, but not as urgent and not as parang hindi siya as explicit as the COVID-19 pandemic, but it's there. It's still there since the beginning of the infection. Okay, now about 6.1 million people at the same time did not know that they were living with HIV and AIDS. Now, what is the implication of this? If out of the 37.7 million, yung 6.1 million na ito, hindi nila alam na may HIV sila. So what happens? So when they have unprotected sex, when they use needles or drug use, parang ganon, they have more risk of transmitting the infection to others. So ganito karaming tao ang makaka-infect pa din ng mas maraming tao. So can you see the dilemma na dumadami lang sila because hindi nila alam na infected pala sila ng HIV and AIDS. Okay, next. Now, let's go back to the Philippines. So in 2008, you can see na 1 case per day lang ng HIV noon. So we can attribute this to because less yung testing or bababa lang talaga yung cases. Now in 2010, 4 cases per day na, tumataas na siya. And then 2012, 9 cases per day. 2014, 17 cases per day. And then in 2022, in 2016, 22, 2017, 27, and then 2018, tumataas siya, naging 31, and then 2019, naging 42 cases per day siya ha, hindi siya per month, per week, it's per day all over the Philippines. Now in 2020, naging 21 cases per day siya. So we can attribute this siguro sa fact na noong 2020 nag-boom yung COVID-19, so less access to testing and hindi talaga nakaka-detect yung people kasi nga hindi sila nagpapatest. Okay, 2021 tumaas pa din siya, 29 cases per day. So from the 2019 na 42 cases per day, naging 29 cases per day lang siya. So we can attribute this to the COVID-19 pandemic na less access to testing. And also, we can also contribute this to siguro yung nag-work na yung advocacies natin na awareness regarding HIV and AIDS and yung mga treatments na binibigay sa ating PLHIVs. Okay. Next would be, now, ito yung regional situations sa Iloilo and sa Western Visayas. So tama kayo kanina, 630 yung cases sa Iloilo City. Now, I have learned na you are from Cavite daw. You are based in Cavite. Okay? So yung cases sa Cavite, Calabarzon, last 2021 was you have 181 cases. So that's actually the highest, that's actually second highest cases or rates sa buong Pilipinas. Number 1 yung NCR with 364 total newly reported cases. Sa Calabarzon, kayo yung second. So you have 181 cases. So just point of comparison lang na almost every year merong 100 plus new cases ng HIV and AIDS sa inyong area. Okay. So next please. Now, dito sa Western Visayas, so every 8 hours daw, merong person na diagnosed with HIV as of February 2018. So, hopefully ngayon, bumaba na siya because of our efforts in stopping the spread of the disease. Okay. Okay pa ba kayo? Can you chat lang like an emoji or something para malaman ko na you're still here? Since medyo talaga, medyo heavy yung topic and medyo, madaming words siguro kayo na kaka-encounter nyo lang. And also, yung next nating presentation will be about the science as to how and why the virus is being transmitted from person to person. Alright, thank you sa mga nag-chat. Gising pa kayo, mabuti naman. Sabi ni Ma'am Sarah, yes, I am listening. Oh, thank you, Ma'am. Okay, so what are the 3 modes of transmission? Pag sinabing modes of transmission, ito yung kung paano siya lumalaganap, kung paano siya nasa-spread among the people. Okay, so number one, we have to know that unprotected sex is one of the number one cause ng pag-transmit ng HIV. So unprotected sex, what does this mean? So basically, people are not using condoms when where they're having sex. Next would be blood transmission. Right. So I will discuss this further later on. Next would be mother-to-child transmission. Right. So ito yon, tatlong transmission: unprotected sex, blood transmission, and mother-to-child transmission. Okay, next please. Okay, so sabi ko kanina, unprotected sex. So what does this mean? HIV can be transmitted sexually through vaginal sex, oral sex, or anal sex. Now, sasabihin nila, ay, hindi naman siguro ako magkaka-HIV if I perform oral sex or anal sex, di ba? But you're actually wrong. Since if you engage in unprotected sex, meaning hindi kayo gumagamit ng condoms, HIV can be transmitted through vaginal, oral, or anal sex. So any type of sex, basta hindi kayo nagwe-wear ng condom, and may contact kayo sa body fluids ng person with HIV, then makaka-transmit talaga ito. Okay, next. Ayan. So HIV can be transmitted during unprotected sexual intercourse or through contact with infected blood, semen, cervical or vaginal fluids of the infected person. So ito na yung 4 na body fluids na sinasabi ko kanina. Tandaan nyo, blood, semen, cervical or vaginal fluids of the infected person. Okay, so what does this mean? Now, if you have unprotected sex, syempre yung skin ng inyong reproductive parts are in contact with these fluids. So may possibility na magtatransmit siya ng HIV. Now, the presence of other sexually transmitted infections or STIs increases the chance of contracting or transmitting HIV. What does this mean? Now, if meron kang sugat from, let's say, chlamydia or gonorrhea or jock itch, di ba? If meron kang mga sugat sa inyong ari, so merong mataas na chance na makakakuha kayo ng HIV if you have unprotected sex. Why? Because yung mga ari natin, exposed sila kasi may mga sugat na. Exposed sila sa body fluids na makakatransmit ng HIV. So if you have pre-existing STIs, so tumataas yung chance na makaka-HIV kayo. Next. Now, so that's all about how unprotected sex can transmit HIV. Let's go to blood transmission. Now, HIV resides in the blood. Nandun siya sa blood ng tao. So HIV infected blood gains entrance to the body through a transfusion. So, transfusion and organ transplant, dapat siniscreen na yung blood. Dapat if you're going to become a donor, blood donor or organ donor, dapat siniscreen yung blood mo for blood-borne diseases such as HIV, Hep B, HSV, HPV, lahat yan siniscreen yan. Because nga, if hindi sila siniscreen, then yung receiver might probably acquire the diseases na meron sa donor. Okay, next. Blood transmission through needle pricks. So this is why mataas yung cases ng HIV among intravenous drug users. Yung mga drug users na gumagamit ng needles, they share the same needles. So usually ito talaga yung one mode of transmission na very apparent siya and very common siya sa illicit drug users na gumagamit ng needles. Okay, next. Sharing of contaminated needles, syringes, razors, or other sharp objects. So this is why if you're going to get a tattoo, make sure na yung needles na ginagamit are clean, new, and they are also disinfected. So kasi yung tendency nito is if you share needles na contaminated, yung probability na yung blood ng tao na may HIV magta-transfer din sa'yo. So that will cause HIV infection. Okay? So next. Now, infected blood entering the body through open wounds. So, i-relate siya natin doon sa sinabi ko kanina na if you do unprotected sex and you already have pre-existing sexually transmitted infections, may mga sugat ka na doon due to certain diseases, now yung blood na ito, mag-enter siya sa inyong body through those open wounds and cuts. And we also don't know if you have unprotected sex and then merong mga micro tears sa ating ari or sa mga reproductive parts or sa part ng ating katawan. So yung blood na may HIV, pwede siyang pumasok doon sa mga open wounds and even sa ating mga mucous membranes sa ating katawan. Okay, next would be, ayan, so that's all about blood transmission. So tandaan nyo lang, blood transmission, dapat bawal gumamit ng share ng needles, share ng razors, or any sharp objects, bawal mag-donate ng blood or mag-receive ng blood or organs na hindi na sa screen, okay? So tandaan niyo lang yan. Next would be mother-to-child transmission. So na-mention to kanina sa game natin na yung mommy, pwede siya makatransmit ng HIV sa kanyang baby. This is during pregnancy. Syempre, merong pagmix ng maternal and fetal blood during pregnancy. So, if yung mommy merong HIV, may probability talaga na matransfer niya yung HIV virus dun sa anak niya. Ito, during delivery, what does this mean? During delivery kasi, hindi maiiwasan na yung baby makaka-ingest or makakalunok siya ng mga vaginal fluids, cervical fluids ng mother, or even dugo. So may possibility na pag nanunok ng baby, yung dugo or yung fluids na may HIV, so magkaka-HIV din siya. Now, after birth through breastfeeding. So naalala nyo kanina yung sinabi ko yung 4 body fluids, yung blood, semen, vaginal fluids, at saka yung breast milk. Now, breast milk is one of the fluids sa ating katawan na magkaka-harbor or nagka-carry ng HIV. So, if a baby from a PLHIV mother, so yung PLHIV is the politically correct term for people living with HIV. So, PLHIV yung tawag natin sa kanila, okay? So, you might be confused as to why I'm using PLHIV. So, we can't call them HIV victims or HIV patients. We call them PLHIVs. Now, breastfeeding, if yung mommy ng PLHIV nag-breastfeed sa baby niya, may possibility talaga na matatransmit yung HIV sa kanyang baby. Okay? Next, please. Okay, so before I go into this, I just want to say that meron talagang breakthrough na with regards to pregnancy and HIV. What do I mean by breakthrough? There are PLHIV mothers na nagkaka-baby, nabubuntis, nanganganak, na yung baby nila hindi HIV or hindi natatransmit yung virus sa baby niya. This is because gumagamit na ng treatments yung mother. So I'll explain that later kung ano yung effect ng treatment sa people with HIV. Basta tandaan nyo lang na it's possible to have a mother na PLHIV and the baby na free of HIV. Okay. Now, sabi ko kanina, 4 body fluids, naging 6 body fluids na siya. Ayan. So, dumagdag. Okay. Pero basically, these are just the same na sinabi ko nina, blood, breast milk, semen, and all the other reproductive system na fluids. Ito, vaginal fluid, rectal fluid from the rectum and anus, and pre-seminal fluid. Ito yung sinasabi nilang pre-cum, yung pre-seminal fluid. So, semen, the cum itself, vaginal fluid, yung mula sa ari ng babae, rectal fluid. You can get this if you're going to engage in anal sex na unprotected. And then pre-seminal fluid. Ito yung pre-cum or pre-ejaculate. And then, dapat tandaan, blood and breast milk. Okay? So next. Now, ito yung tanong kanina, is there a cure for HIV daw? So meron nga ba? Syempre, nasagot na kanina, wala pang cure. Pero we have treatment. Ayan. Treatments in the form of antiretroviral drugs. Now, what do these antiretroviral drugs do? Now, di ba yung virus, pakiback muna, Adi. Okay. So yung virus natin, syempre, pag na-infect ka, dumadami yung virus sa ating katawan. They have to reproduce, they have to multiply. So dadami siya ng dadami. Now, what do these drugs do? Pag ininom mo to, yung viral replication o yung pagdami ng virus, bumababa o humihina. Or minsan, nahihinto pa. So this is very beneficial to our PLHIVs because yung viral load nila bumababa. When I say viral load, ito yung dami ng virus sa ating katawan. If they take these antiretroviral drugs, bumababa yung viral load sa kanilang katawan, and in turn, pwede na silang uh, hindi na madedetect sa testing yung viral load kasi masyado nang mababa. So this is also the reason behind yung mothers na nabubuntis na PLHIV tas yung anak nila hindi nagkaka-HIV kasi umiinom sila ng gamot na nagpapababa or nagpapahinto o nagpahihina ng pag-replicate ng virus sa kanilang katawan. So I think I hope that's very informative sa inyo na even though HIV doesn't have a cure yet, meron namang treatment na makaka-help sa ating PLHIVs. And these treatments are also free free and paid by the government, which I will discuss later on. Now, we've talked about the modes of transmission of HIV, the 6 body fluids, and the treatment. But we always go back to knowing our ABCDE because we believe that prevention is better than cure. Now, in order to practice preventing the spread of HIV, you have to understand or you have to know by heart yung A, B, C, D, and E, yung limang to. Ano ba to? Okay, now, A. A is for abstinence. You don't have sex. Wait, back mo na. Ako na, Adi. Okay, thank you. So, A is for abstinence. You don't have sex, you don't use or share needles, and huwag kang mabuntis. Ganun lang siya, di ba? So, abstinence talaga. Now, if hindi mo kaya yung abstinence, if hindi talaga siya pwede, like, karat ka na talagang mag-have sex or gusto mo talagang, do other risky activities, you should do, next, B. Be mutually faithful to your partner. Now, i-emphasize ko yung mutually. Dapat kasi sa isang relationship, if you're in a committed relationship and you're engaging in sex, you have to be mutually faithful to each other. Hindi pwedeng ikaw lang. Kasi ikaw nga lang, pero yung partner mo, meron pang partner na iba. So, the risk is there. The risk of getting HIV is there if you're not both mutually faithful to one another. And this also comes na if you're mutually faithful to each other, you get tested together para alam niyo yung status niyo. Diba? Okay, next is C. Ito, correct and consistent condom use. Now, sasabihin nyo, okay, nag-condom kami ngayon, bukas hindi naman, or mamaya hindi na. So, tapos magko-condom nga kayo, hindi naman tama yung paggamit nyo ng condom. So, that defeats the purpose of using condoms. So, C is for correct and consistent condom use. Now, dapat tama and dapat consistent. Ayaw natin ng inconsistent, di ba? Ganon. Okay, next. D. D is for, don't reuse or don't share needles. Kasi nga, going back to the mode of transmission ng HIV, which is blood transmission. So, don't reuse or don't share needles. Okay, E. What is E? This is why pala, TDB is here, orgs like TDB is here for education and early detection. Now, one way of preventing the spread or the transmission of HIV is for us to educate about the risks that comes with HIV, and we have to educate people on how to protect yourselves, on how to prevent this from occurring and from transmitting to others. And also, early detection. We don't want na if may HIV na, magpo-progress siya into AIDS stage because that would be a problem. So, which is why TDB is here to help get you educated about HIV and AIDS, and also to help early detection for those na suspected PLHIV. So, dapat early talaga ma-detect para early pa siya mabigyan ng treatment. Okay? Now, if you have five talaga, ito talagang five yung dapat yung tandaan. Abstinence, be mutually faithful to your partner, correct and consistent condom use, don't reuse or share needles, and E, education and early detection. Ayan. Now, so ito yung sinasabi ko kanina na U equals U. Undetectable equals untransmittable. So siguro maalala niyo yung sinabi ko kanina regarding treatment, 'di ba? If you continue drinking treatment or taking treatment, dadating yung point na bababa na yung viral load nyo and hindi na siya madedetect sa inyong blood. Now, if you undergo HIV testing while you're also taking your medicines for for HIV, magiging undetectable na to. And now, if undetectable na to, magiging untransmittable na din siya. Hindi mo na siya matatransmit sa other people kasi mababa na yung viral load nyo. But be careful with U equals U. This will only be achieved if yung PLHIV natin, iniinom nila yung gamot nila regularly, religiously, and adherent sila. Meaning, dapat hindi nila skip yung pag-inom ng gamot para ma-achieve yung undetectable equals untransmittable. So this is the beauty of science and medicine. Kasi noon, pag sinabi mong HIV, wala nang cure, wala na, parang it's the end of the world for everyone. But now, we have medicines, we have antiretroviral drugs na magiging undetectable and untransmittable na din yung viral load ng PLHIV to other people. But this should be also made sure na naintindihan ng people na this can only be achieved if umiinom ng gamot on time and dapat hindi niya siniskip yung pag-inom ng gamot. Okay? Next, please. Ayan. So, yung A, B, C, D, E, naging UU na siya. Dagdagan ng UU. Para, encouragement na din sa people living with HIV na to consistently drink their meds. Okay? Next. Always remember that no matter who you are, you can get infected. So, tandaan lang natin na the risk, next please, the risk of HIV infection depends on the behavior and not the identity of the person. So regardless if how you identify yourself to the community, kung paano yung how you see yourself, this not is not really ano nga to, parang the risk to HIV infection does not depend on the identity, but it also boils down on how you behave. So, dapat tandaan natin na para maiwasan yung HIV infection, we should practice those ABCDE na preventive measures. Okay? Next, please. So, education is the first step to removing the stigma, which will be discussed later on by Adi. So tandaan natin to, that education is nothing without action. So I hope that after today's lecture or today's event, you will also have time or you will also do your part in sharing what you learned to other people. Kasi you'll be surprised na madami talaga pang people na hindi pa sila aware regarding how HIV and AIDS work or paano yung stigma na nangyayari or na present dito sa atin. And also, I hope that you will also be part of our advocacy na it's important talaga to know the science in order to stop the stigma. Okay, so here in TDB, ito talaga yung aming tagline. So, know the science to stop the stigma. So, thank you everyone. We'll see each other later sa ating next na lectures. But for now, if you have any questions or concerns or comments regarding the topic on the mechanism and the science behind HIV and AIDS, so you can chat them down here because I will try to answer them later sa aking next na session. So for now, thank you. And I'll pass the floor to Adina.
Thank you very much, Ate Cara. We truly learned a lot, no, on what is HIV. So we've learned na different pala, no, si HIV sa kay AIDS. And also we've learned about the modes of transmission and how to prevent them, di ba? So ang dami nating learnings from Ate Cara. So Sige nga, isang malaking inhale, exhale para ma-digest natin yung lahat ng learning natin. Inhale, exhale. Daming learning, no? Daming words. So I hope that you'd still be able to grasp all of these because this is all for our hard work, no? Yung tagos sa puso nating ginagawa, our advocacy in order to stop no the spread of HIV and AIDS in our community in our country. So it's also for us to stop the stigma, not only for those who are already members no, of the PLHIV, but also for us to stop uh, suspecting people of having HIV and AIDS because those are actually illegal, and we're going to be talking about that right now with our next topic: stigma and discrimination. So, what is stigma? So, stigma is the unfavorable attitude, no, and belief directed towards someone or something. How about discrimination? Sige. So discrimination, on the other hand, is the treatment of individuals based on their membership or association with a group. So once again, no? So in shorter term, para mas madali nating ma-digest, stigma refers to unfavorable thoughts, no? Yung mga thinking natin na, hindi ako mag-associate sa kanya. So it's just the thought. Okay? So it's the unfavorable thoughts na nasa isip natin. On the other hand, discrimination is yung ginagawa na natin based on our unfavorable thoughts. So these are our behaviors born from that thought. So, for example, feeling ko may HIV siya. So, ano yung gagawin mong discriminatory? Itatakwil mo siya or parang you're going to stay away from that person. Yun yung discrimination. Okay? So we need to stay away from the stigma and discrimination against persons living with HIV and against our fellow people, our fellow countrymen. Ayun. So next, why is HIV and AIDS highly stigmatized? So we have a lot of reasons for this. One of these reasons are life-threatening illness kasi yung HIV and AIDS. Yes, life-threatening illness nga yung HIV and AIDS. Kaya lang, meron na tayong treatment na sinabi kanina ni Ate Cara. So, all hope is not lost. Okay? So next, apart from that, it is also highly contagious. So highly contagious daw yung HIV and AIDS because akala ng iba, makukuha mo siya sa pag-hug sa APL-HIV, sa pag-usap sa pagiging just a conversation buddy with APL-HIV. So there are a lot of stigmas that we need to debunk as well. So later on, we'll be talking about that. And then strong views about sexual behavior as well. So we've discussed earlier with Ate Cara that it's not just with unprotected sex that you can actually acquire HIV, right? So we need to remove the stigma that HIV and AIDS is just associated with sex alone. Okay? So next, we also have courtesy stigma. This is stigma by association. So ayaw nating ma-associate with a PL-HIV. So by saying that ayaw ko sa PL-HIV, ayaw ko sa mga HIV persons, ganon. So we try to disassociate ourselves with them. Para tayo din, no, we're going to be kind of like free from that stigma. Ayun. So next, stigma is more intense when HIV and AIDS is seen as untreatable. So ito yung pinaka nakakatakutan ng lahat na ayaw nila magkaroon ng HIV and AIDS because para sa kanila untreatable daw ito na parang if you have HIV and AIDS, end of the world na kagaya ng sinabi ni Ate Cara. Kaya nga, we need to educate our fellow workers, no? Kasama natin dito sa MedResults at saka yung mga viewers natin ngayon that HIV and AIDS actually have treatment. Ayun. So, hindi na siya untreatable, meron siya treatment. So, people believe that virus transmission was as easy as sitting together, no, beside a jeepney or a train or bus or kung ano man yung ginagamit nyo for transportation. No, they also see it na parang kung kakainin mo yung pagkain na niluto ng PLHIV, magkakaroon ka ng HIV and AIDS, which is actually also wrong, no? And breathing the same air. So, kapag may katabi ka dyang PLHIV, inhale, exhale ka dyan, makakuha ka ng HIV, which is wrong din, di ba? And then, of course, just wearing the same clothes na ginagamit din ng PLHIV. So, all of these are actually wrong. And we would like to debunk them right here, right now, na hindi po ito totoo. Okay? So next, know the science, stop the stigma. Ito yung aming tagline, slogan namin sa Team Dugong Bughaw, which we would like to share with all of you right here, na yung 51 participants natin dito sa Zoom, at saka yung sa Facebook Live natin. So, we need to know the science, gaya ng sinabi ni Ate Cara kanina. So, first, how do we stop the stigma? So, we need to meet the need for HIV and AIDS information, which we are trying to do right now. We are trying to educate you. We are trying to share with you our knowledge, our time, no? Na HIV is not untreatable. We have treatment for HIV, and we would like you as well as viewers, as participants here in this Zoom meeting, to share with your family members, with your friends, yung information that we have learned here in this webinar. Next, we need to also increase training in healthcare for PLHIV. Because kagaya ng sinabi ni Ate Cara, 6.1 million people pa around the world are actually unaware, no? Or hindi pa sila nagkakaroon ng screening or testing. So they're not aware kung PLHIV ba sila, or if ever that you have already been in contact with with a PLHIV. So we need to increase healthcare training for them in order for them as well to be equipped kung ano yung gagawin nila when they have contracted HIV. Is it really the end of the world for them? No, diba? We have to tell them that there are treatment hubs here around the country, near their locality, that can be their point of information, no? Their point of getting their treatment. Next, we also need to share, no, or also need to increase our acceptance and support, because sometimes, no, when when the world is against them, it's like they have they have nothing else to go to. We need to show them that we are here. We are here for them. That this is not the end of the world. That there are actually already available treatments that we could help them actually achieve, no, or gain that untransmittable, undetectable is equals to untransmittable, no, yung yung kagaya ng sinabi ni Ate Cara, so that they could live their lives normally. And then, of course, number four, increase access to HIV prevention, treatment, and care. So, HIV prevention, treatment, and care, we would like to uh, inform you guys that our government are continuously, no, doing their best kasama ng ating DOH to improve na yung ating healthcare system dito sa Pinas, especially for prevention, treatment, and care. And of course, our DOH as well is actually conducting trainings for HIV. So if you would like to join those trainings, you could actually contact them. Ayun. So next, human rights. So human rights is not limited to us. It's limited. It's actually inclusive. It's for everyone. Kasama na siyempre ang ating persons living with HIV. So part of these human rights is the freedom from discrimination. Ayun. So discrimination against persons living with HIV or those thought to be infected is a clear human rights violation. And we have Philippine laws that actually defend us from these human rights violations. So we have here, kagaya ng in-answer nyo kanina, no, doon sa ating 1 versus 100, yung Philippine HIV and AIDS Policy Act, or the RA 11166. So, sorry. This act strengthens the Philippine Comprehensive Policy on Human Immunodeficiency Virus, or HIV, and Acquired Immune Deficiency Syndrome, or AIDS, prevention, treatment, care, and support, and reconstituting the Philippine National AIDS Council, or PNAC, repealing the purpose of Republic Act number 8504, ito yung previous na act na for HIV din, otherwise known as the Philippine AIDS Prevention and Control Act of 1998. So ito na yun, dito na tayo mag-focus sa RA 11166. So kapag may nakita kayong discrimination na nangyayari sa inyong workplace, ito yung sabihin niyo sa kanila. Alam niyo bang may RA 11166? Ayun, di ba? So pwede silang makulong. So part of this RA 11166 includes confidentiality of HIV testing with counseling before and after testing. So if ever that the person living with HIV has been in contact, no, with a counselor, no, or parang gusto niya magpa-test, so there's actually confidentiality. Hindi ito pwedeng spread ng person na nag-screen, na nag-test, no? Hindi ito pwede ma-spread yung results niya, na nag-screen siya or nagpa-test, na hindi pwede yan ma-spread. because it's actually covered by RA 11166. Ayun. So next, we also have testing. So testing should be adequate and affordable. Kagaya ng sinabi ni Ate Cara kanina, no, it's actually sometimes free in designated locations here in the Philippines. Testing, screening is actually free. So dapat wala itong payment, no, when it comes if ever that person is suspectful, no, na meron siya, na isa siyang PLHIV or suspected PLHIV siya. Next, there are also penalties for breaching of confidentiality. Kagaya ng sinabi ko kanina. So, discrimination against PLHIV is illegal. So, employers cannot discriminate, fire, or do other things. No, schools cannot deny applications. Hospitals must not refuse treatment. So, if ever that you are aware that some of these things are actually being done in your workplace, in schools din ng mga kamag-anak nyo, or in hospitals, it's actually illegal, no? Because it's part of RA 11166. So, pwede nyo sila ma-report sa kinauukulan. So, there are also updates because kagaya ng sabi ko kanina, there's actually already the previous law, no? RA 9508. And now for the update, because na-repeal siya, ito yung update. The main body now in charge of HIV and AIDS related program is the PNAC, no, or the Philippine National AIDS Council, which was reconstituted to apply the 6-year medium-term plan to address the growing cases in the country. The Department of Health is also ordered to establish a program to provide free and accessible treatment hubs, public or private hospitals for all persons living with HIV or PLHIV. Okay, so next, one major update is for the consent for HIV testing. Ito yung pinaka-major na update for RA or 11166. The new law now allows minors age 15 to 17 years old to be tested. Before kasi, 18 years old and above lang yung pwede na without consent. So like those ages before, those ages na lower than 18, hindi sila pinapayagan, no, without the consent of their parents. However, right now, with our RA 11166, ages 15, no, minors 15 to 17 above, pwede na ngayon without consent of their parents na magpa-test for HIV. So any person below 15 who is pregnant, married, or in high-risk behavior should be considered a mature minor and be allowed to give their own consent for HIV testing. Kaya lang ayon. So we have still these qualifications: pregnant, married, or in high-risk behavior. Ayon. So next, ito rin yung main points ng RA 11166. So first is for public awareness through comprehensive nationwide educational and information campaign. Kaya nga sinabi ko, there are actually free trainings which are conducted by the Department of Health, which you could also attend. You could just contact them if you want to have these trainings, or contact your local HIV treatment hubs that if ever that they were contacted by the DOH, that there were going to be trainings that will be conducted. So later on, we'll be sending to you via this Zoom chat ng siguro, no? Or Ate Cara perhaps could send to you via this Zoom chat yung ating yung ating mga treatment hubs near your area. Ayan. So next, we also have full protection of the human rights and civil liberties of every person suspected or known to be infected with HIV and AIDS. So hindi tayo pwede magpadalos-dalos, no, na magsabi na okay, baka because nag-spin siya, because parang namayat siya, no? Namayat siya. So baka may HIV na siya, hindi ko pwedeng nag-diet lang, di ba? So ayun. So may full protection yung mga tao from the stigma and discrimination on the workplace. And then there's also the safety and universal precautions and practices and procedures that carry risk of transmission. So kaya sinabi ni Ate Cara, dapat na-screen talaga, dapat muna yung mga blood transfusion, no? Yung mga blood transfusion natin, yung mga syringes na ginagamit sa hospital, dapat one-time use lang talaga. So there are these safety universal precautions na ginagamit sa mga hospitals natin, sa mga healthcare providers din natin. So you need to also be aware of these, no? Na dapat kapag nagamit niyo yung mga syringes, hindi na pwede gamitin ulit. You need to tell them kapag nakita mo ginamit pa nila ulit, no? Nag-reuse pa sila ng mga syringes. Sabihan niyo sila, it's actually against RA 11166. And next, it's also to positively address and seek to eradicate conditions that aggravate the spread of HIV infection. What are these conditions? some of these conditions actually include the stigma and discrimination because natatakot yung tao, hala, baka magpa-test ako, baka sabihin ng mga people na makakita sa akin na baka may HIV ako. So, I will be stigmatized. I will be discriminated sa aking workplace. So, natatakot ako magpa-test. 'Di ba? Ayaw ko mawalan ako ng trabaho, ayaw ko mawalan ako ng school, na pag-aaralan, ayaw ko malaman ng parents ko. So, natatakot sila. 'Di ba? So, kailangan nga, we need to positively address these problems through confidentiality and of course through improving our healthcare systems, our healthcare provider systems here in the Philippines, which we are currently addressing through this or a 11166. Para hindi na tayo matakot magpa-test. It should be normalized, kumbaga. So next, participation of affected individuals in propagating vital information and educational messages about HIV and AIDS. So sino yung affected individuals? Tayong lahat community. And of course, kasama dyan yung mga PLHIV natin. So we need to participate in these programs because it's our community, it's our country that is at stake. So let's be active on this advocacy. So that's all for stigma and discrimination. And now let's go back with Ate Cara, no, for VCT and CBS. Ate Cara, are you ready for the next day?
Yes naman. So, how about our participants? Okay pa ba kayo, guys? Okay pa? You can chat sa chat box yung... Ay, merong ganito. Okay. So, let's proceed na siguro. Or do you want to take a break? Kahit 1 minute lang. Breather to stretch. And, drink water. Or go to the restroom. Pero feel free naman kayo, guys. Don't worry. Chill lang tayo dito. Sige. So, let's start na lang sa at aking next na presentation, which will be VCT and CBS. So, kanina, tinanong yung ano daw yung meaning ng VCT and CBS. So, sabi, voluntary counseling and testing and community-based screening. So, what do these terms mean? Anong pake ko dito? Ba't tinuturo sa akin to? Ganon, di ba? Maiisip nyo yan. Now, VCT, voluntary counseling and testing. Next, please. So, going back, before I explain what VCT is, just a background lang on how testing for HIV works. So, we have two tests. Ito yung antibody test and antigen test. Now, for those of you who are not yet familiar with these terms, yung antibody, ito yung kinikreate, yung ginagawa ng katawan natin, ng immune system natin to fight off yung mga illnesses and bacteria. So, yung antibody na to, example nito yung mga white blood cells natin, yung lymphocytes, T cells, gano'n. Pero in general, we call them antibody. Now, yung antigen are any foreign objects or pathogens or yung mga sakit, mga virus, parasites, bacteria na dumadapo sa ating katawan. Now, what do these terms mean? So, antibody test is a test that directly measures antibody test is a test that measures the response of one's body to the presence of HIV. Nagkabaliktad lang sila. But ito yon. Antibody is yung response ng body to the presence of HIV. Now, why and how? For example, nagka-infection kayo. Syempre yung katawan natin gagawa sila ng antibody to fight off those infection or infective agents. Na yung antibody test na to, kine-create niya ito. Sorry, Adi?
Wait lang ate. Wait lang po.
Okay, so carry on. Yung antibody test na to, ito yung mini-measure niya kung gaano karaming antibody yung produce ng ating katawan para i-fight off yung illnesses. Meanwhile, yung antigen test, ito yung nagme-measure directly sa virus, kung ilang virus na yung pumasok sa ating katawan. So, ito na yung, dito yung papasok yung viral load na sinasabi ko kanina. Yung antigen test, mini-measure niya yung viral load. So, ayun. So, these are the tests na parang ito yung background ng tests for HIV. Okay, next. please. Now, ito, hindi ko to na-discuss kanina, but just for your information, this is a timeline ng HIV infection. Yung blue na color, it represents the person's health. Yung white, ito yung mga ito yung mga virus or viral load. Yan. So, your infection starts at 0 to 12 weeks. Ito, yung puti na yan, sa taas ng window period, ito yung time na nagka-virus yung katawan. Ito yung HIV infection. Kaya, parang nadumisan yung health, yung blue, nagka-white. And then, as you go on, until 2 to 3 years yung AIDS stage, bumababa yung health ng tao. At dumadami yung white part that represents the viral load. So, eto, meron tayong yellow and blue. Okay, balik mo na, Adi. Sorry. Meron tayong yellow and blue lines. Now, di ba sabi ko kanina, yung antibody test, nagde-detect ng antibodies. Yung antigen test, nagde-detect ng viral load. Now, what happens with the antigen test? Ito yung yellow na ito. Tandaan nyo to. Now, nung HIV infection, tumaas yung viral load. Tapos bumaba, and then tataas ulit. Now, yung antibody test, tumataas din yung antibodies by the time na na-infect na yung tao. So we have to make sure that we test on the right time. Kasi pag nag-test kayo ng antigen test sa time na mababa yung viral load, hindi yan madedetect ng ating testing. Now, if mag-test naman tayo during the time na wala pang antibodies yung katawan natin, yung antibody test, hindi niya yan i-detect yung HIV. So, yung importance nito is yung timing. Hindi pwedeng nag-test lang tayo anytime, hindi pwedeng magte-test lang tayo kung kailan natin gusto. We have to make sure na yung test na ginagamit natin will also detect yung HIV antigen or yung HIV na viral load or yung antibodies na pinoproduce natin. So this is very important. Just to give you a background or parang base knowledge on how these tests work. Okay, next please. Now, sinasabi natin kanina, voluntary counseling and testing. So obviously, HIV testing is voluntary. So you cannot be forced by someone to get tested. You cannot be required by someone to get tested. Because nga, voluntary siya. It's all in the RA 11166, which is the Philippine HIV and AIDS Act. Na dapat, you cannot force people to get tested if they don't want to. Because nga, HIV testing is voluntary. So pag sinabi sa'yo na, I will force you, you have to do this, pero ayaw mo, you have all the right to decline testing. Kasi nga, voluntary siya. Next, please. Ito, pinaka-importante, na-discuss to kanina ni Adi, yung confidentiality. Now, since yung status ng isang PLHIV is confidential, obviously, dapat yung HIV testing confidential din siya. Nobody should know about your status or about the fact na nagpa-test ka except you, your counselor, and your doctor. Ganon. So, dapat confidential siya. You have to understand and remember that. Okay? Kasi para naman if ever na ma-break yung confidentiality na ito, you will have reasons to file a complaint to that person. Okay? Next. Now, HIV testing is anonymous. Meron tayong testings na hindi na natin binibigay yung ating name. So, meron tayong binibigyan tayo ng code and then contact number lang. Pero some tests also requires names and information para lang naman for record keeping at saka for follow-ups if ever. Ayan. So, it will depend on the test. I will discuss that later on. Next would be, ayan. So, tandaan nyo ha, HIV testing is voluntary, confidential, and anonymous. Okay. Next, please. Why should I get tested for HIV? Now, if you're going to get tested for HIV and then you come out positive for HIV or naging reactive yung inyong test for HIV, you will gain access to what? Treatment care, ayan, and support services such as CD4 count, viral load, and ARVs. Now, if you get tested for HIV and nakitang meron ka talagang HIV in your body or PLHIV ka na, you can have access na free and given by the government and other treatment hubs. You have access for treatment care. Bibigyan ka ng mga lab result, mga lab tests, check up ka, meron mga doctors, psychologists, and the whole healthcare team to take care of you. And also, support services such as CD4 count. Yung CD4, ito yung antibody na sinasabi ko. Yung viral load, syempre kakount yan kung madami pa yung viral load mo or undetectable na. And then free ARVs or antiretroviral drugs, the support services. So it is also very important for you to get tested to be able to gain access to these. Okay? Next. Now, how long after possible exposure should I wait to be tested for HIV? So, remember yung sinabi ko kanina about the chart, parang timeline na yon that is very important because you have to wait before you get tested. Now, how long ba? Gaano katagal? Okay, next please. So, you have to wait to get tested for HIV 3 weeks to 3 months after possible exposure. So, one story lang na I would like to share is meron lumapit sa akin ng friend ko na meron daw siyang friend na gusto magpa-screen for HIV because yung naka-hook up daw niya last night said na PLHIV yung person and then hindi daw sila nag-condom. So, yung friend ng friend ko was freaking out so she wanted to get tested, ganon. So, I said na you can't get tested right away. You need to wait for at least 3 weeks to 3 months to get tested. Because during the span of 3 weeks to 3 months, dito dumadami yung antibodies natin na madedetect na ng test. Or dito dumadami yung viral load ng person para ma-detect ng test. And it's also important to note that within these 3 weeks to 3 months, dapat no sexual before getting tested, dapat wala na kayong other sexual activity. So you have to abstain for at least 3 weeks before you get tested pa. Para naman ma-ensure na sa tao mo talaga na gano'n yung nakuha mo, dun mo talaga siya nakuha and not from other people. Okay? So next. Why should I get tested for HIV? Ito, syempre, for precaution to prevent the spread of HIV to others. And also para din malaman mo yung status mo. So, it is advised na we get tested every year kasi free lang naman yung testing and screening. So, it is also a precaution kasi baka hindi mo alam, hindi ka nga nag-unprotected sex pero baka na sugat ka sa tattoo parlor or anywhere na pwedeng makatransmit sa'yo ng HIV. So, this is also to prevent the spread of HIV to others. Syempre, if alam mo yung status mo, you will be more careful para hindi na ma-infect yung other people, okay? Next, please. Now, it is also recommended by healthcare physicians. Syempre, as a general checkup na din, we don't want na bulabugin lang kayo, hindi nyo alam, naka-AIDS, may AIDS na pala kayo, tapos hindi kayo na-test, di ba? So, we also encourage our patients na dapat dapat we get tested regularly for HIV AIDS. Okay? Now, where can I get tested for HIV? So we have ayan, ito kasi it's applicable to Western Visayas. But as I have looked up, we have several testing centers sa Calabarzon. Ayan. Ito, I will send the link dito sa chat. You can check it out. Tapos dito din yung data for HIV. So, ito, treatment hubs and primary care. Sa 4A, you have Batangas Medical Center. Ayan. And also, you can go to Calamba Doctors Hospital, General Emilio Aguinaldo Memorial Hospital, Laguna Medical Center. So, ayan. So, these are just some of the facilities na near your area. Ayan, thank you, Adi, for sharing. Also, as far as I know, every public hospital na malaking parang tertiary hospital like PGH, they offer also free testing sites and testing services kasi meron talaga silang department doon sa PGH where you can get tested. So, and also, meron tayong mga social hygiene clinic. Dito merong Iloilo Social Hygiene Clinic. Sa Manila, meron sa Pasay, sa Pasig, na free. They offer free testing for HIV. Okay? Next, please. Ayan. Yung treatment hubs na din, you can find that there sa ating link din. So, usually, kung meron testing site, meron ding treatment hubs doon most of the time. You can acquire your antiretroviral drugs doon. They offer that through DOH. And then, meron ding regular testing and checkup. Okay? Next, please. Ayan. So, I've discussed that. So, other testing sites, ayan, sa Western Visayas kasi yan. Pero sa inyong area, andito talaga sa registry. It's there and it's updated. Now, yung tanong, are my test results confidential? So, pwede bang malaman ng iba or may right ba yung doctor ko na ipagsabi sa family ko or sa friends ko or sa partner ko? Your HIV test results are absolutely confidential as mandated in RA 8504 and RA 11166. So yung RA, itong mga RAs talaga ito, they are the ones responsible na nagsasabi talagang absolutely confidential yung test results mo. So, kung ikaw gusto mong i-divulge to other people na PLHIV ka, that's okay because that's your right. Sa'yo naman yan, sa yung test results yan. But, if sinabi sa iyo ng PLHIV and then ipinagsabi mo sa iba, then you are also held liable kasi it's not your story to tell. Parang ganun. It's not your result to tell. So this is absolutely confidential. Your doctor cannot cannot talk about your results to anyone except you. They cannot talk to your family about this. Hindi nila pwedeng sabihin na, ay, yung anak mo, ganto, ganyan. Ay, yung partner mo, ganto, ganyan. Kasi it's absolutely confidential. Okay? Next, please. Now, consent. So, by virtue of RA 11116, 15 years olds can have themselves tested without consent. So, what does this mean? Kasi before, sa RA 8504, if you are below 18 years old, you need to have consent from your parents. But by the time na lumabas yung RA 11166, even 15-year-olds can have themselves tested without consent. So they can go to any testing hubs or CBS motivators and they can get tested without their parents' consent. Okay? Next, confidentiality. So ito yung sinasabi ko kanina, the results stay between the doctor or the counselor and the patient. Yung counselor, ito yung mga people na nag-offer din ng HIV screening as CBS motivators. And sila yung kumakausap sa inyo before and after testing. Okay? Next, please. Counseling. Ito, pre and post-test counseling is provided. What happens during counseling? So before getting tested, ini-explain sa inyo what is HIV, how is it transmitted, and then at the same time, sinasabi sa inyo na if ever ganito yung result, this means this, ganito ganyan, and then yung post-counseling naman is if ever you have your test results, such as for example, naging negative ka, your counselor will tell you nga, you have to get tested regularly, you have to use protection regularly, ganon. But if your test comes out positive, your counselor will talk to you about the options, treatment options, if you want to get admitted, ganito ganyan, yung parang saan ka kukuha ng inyong mga meds, yung mga laboratories, ganyan. So, hindi kayo pinapababayaan ng mga counselors natin. So, pre and post testing, counseling talaga is very important. Okay? Next. What if I'm tested negative for HIV? Now, this means that you have no antibodies were found in your blood at the time of testing. So kaya nga sinabi ko kanina that you have to wait 3 weeks. Kasi if you test earlier and then negative pala siya, you cannot really be sure if you're truly negative. So it is advisable to get retested at a later date. For the meantime, take appropriate precautions. Now, if negative ka for HIV, pero you're still doubtful, you can get tested at a later date to give time for your body to react then. Okay? Next, please. All right. So, um, available care and treatment for PLHIVs. Now, if you are a PLHIV, you can get access to these treatments and these mga programs such as your VCT, voluntary counseling and testing, support for prevention of onward transmission of HIV. Ito yung follow-up counseling. Palagi ko na text ng counselor nyo, kamusta ka na? Anong gusto mong gawin? Parang ganyan. They usually always follow up and check up on you. Ganon. Advice on food and nutrition, since our PLHIVs are very prone to illnesses and diseases, so they have to maintain a healthy diet and nutrition. Ito, treatment of STIs. Ito kasi usually more prone din sila sa mga STIs such as your gonorrhea, your jock itch, chlamydia, yung mouth thrush, gano'n. So, they get treated for this for free din. And then management and nutritional effects, prevention and treatment of opportunistic infections, and provision of antiretroviral drugs. So usually kasi, yung nakikita namin sa mga PLHIVs, they are prone to pneumonia and tuberculosis. So if you are prone to these opportunistic infections, you have to get treated and para din ma-prevent. So they're usually given vaccines and treatments for pneumonia. Okay? And very important, binibigyan kayo ng antiretroviral drugs. Okay. Next, please. Now, we've talked about voluntary counseling and testing. Ito naman, community-based screening. That one was testing, which is actually confirmatory talaga na test. Parang ito yung gold standard when it comes to HIV testing. But for community-based screening, syempre, we took the initiative, DOH took the initiative na yung CBS is to be made available to everyone. Parang hindi mo na need pupunta sa mga treatment hubs to get tested and to get screened. So this is why community-based screening is here. So next, please. So what is CBS? So eto, rapid HIV screening done in a non-laboratory setting. So actually, organizations train lay providers to conduct safe and effective HIV screening using HIV rapid diagnostic test kits. So what they do is that they train people na willing, such as us, like I am a trained CBS motivator, so I can give screening to you for free anywhere. Kahit puntahan ko pa kayo sa bahay nyo, as long as you're near, pwede I can test you, parang ganon. So you don't need to go to testing hubs to get screened. Ito. However, this is not meant to replace diagnostic testing options currently available in the country. This is only for screening talaga. Parang instead of going immediately para magpa-VCT kayo, you can get screened naman. If you're negative, if you're non-reactive, then that's great. That's okay talaga. Kasi non-reactive ka. But if naging reactive yung result mo sa CBS, you have to undergo confirmatory testing pa. That doesn't mean that if you are reactive or reactive ka talaga sa CBS, that doesn't mean na final na may HIV ka. Okay? So kasi, this is not meant to replace diagnostic testing. This is just for a community setting talaga na mabilisan, ganon. Next, please. So, ito na yung comparison ng dalawa. So, these are not entirely different tests and not entirely different programs na ating compare, no? But for CBS, mas mabilis siya because you can get the results as fast as 15 minutes. Kasi, ano lang siya, test kit lang siya. Have you seen the, yung parang pregnancy test kit, pero instead of urine, yung ginagamit blood. Okay? Next is, sa CBS, anonymous talaga, hindi ka na magbibigay ng ng pangalan mo, ng address mo, ganon. You are only given a code and contact information. So yung code na to, that's totally unique sa inyo. So binibigyan ka lang ng numbers kasi if ever your counselors or your CBS motivators will contact you if ever na merong mga follow-ups na needed. And then next is walang syringes, only a small pinprick and a drop of blood. Yung ginagamit dito yung lancet lang. And usually, piniprick lang siya dito sa finger. And then, maliit na blood lang yung kinukuha sa inyo for CBS. Meanwhile, for VCT, matagal siya. Medyo 2 hours pa, more or less 2 hours yung hihintayin nyo para lumabas yung results. And then yung all clients provide name and other personal information and you need to fill out the form. Pero, regardless if magbigay kayo ng information nyo, you have to understand na anonymous naman siya and confidential and nobody will know about this. Next is yung isang syringe ng blood talaga yung extracted. Usually 5 ml ata yung ine-extract na blood for VCTs. And this is done in a laboratory to ensure yung safety and then yung hygiene naman talaga na hindi kayo mai-infect or something. Okay? So this is just the comparison between CBS and VCT. So I hope that's clear na for you all. Pero yung takeaway dito is regardless if you get CBS or VCT, these are reliable tests naman. Okay? Next, please. Ito. So this is in Iloilo. So we usually just show these to our audience para naman they know where to go. But if ever na merong mga may PBB members dyan sa Cavite or sa Manila, you can contact us naman. Baka meron naligaw, ganon. So, yes. So, hopefully na understand nyo yung difference between CBS and VCT and how they are also very important talaga to control the spread of HIV infection. So, we encourage you all to get tested. I hope na merong malapit na screening and testing center sa inyo or like mag-offer yung results ng free testing, di ba? So, ayan, we'll really appreciate that. And syempre, para naman sa inyo, malaman niyo yung status niyo. Hindi kayo kakabahan. Okay. So, for now, Adi, anong next nating activity?
Hi, Ate. Condom lineup na yung next. I think that's going to be for you as well.
Condom lineup na tayo. Okay.
Yes, pa.
Okay, so usually, before the pandemic, this is the most exciting part ng PHF namin kasi we encourage everyone to join. So this is the condom lineup. So na-remember nyo sa A, B, C, D, and E ng prevention ng HIV, nandun yung correct and consistent condom use. Now, alam nyo ba paano maglagay ng condom? Ako pa chat sa chat box. Alam nyo ba? Sino dito yung nakakaalam paano gumamit or magput ng condom? Ay, walang nag-chat, Adi! Guys, huwag kayong mahiya. Charot. Ayan, si Adi, marunong daw siya. That's very good, Adi. So, it's also important for us, women and men, na malaman kung paano gumamit ng condom. So, welcome to our condom lineup. Ayan. Next, please. First and foremost, these are the 6 steps to proper condom use. Okay, so I have here a condom. Wala lang akong model. Wala akong talong. Kasi usually talong yung ginagamit namin para mag-demo, di ba? So, number 1 is that you have to talk with your partner about using condoms and lubricants. Siyempre, the first step in having sex is consent. Di ba, hindi naman pwedeng mag-have sex kayo without consent of each other. So, this also involves talking to your partner about using condoms. Sabihin mo na we're going to have sex but I would like to use condoms for protection. And you ask your partner, meron ka bang allergies sa condoms or lubricants, ganon. So, it's important that you talk it out. Okay? And next, please. Okay, so, now, this is the packet of condom. As you can see, ayan. Ito, free lang to. Binibigay to ng FPOP, ISC, at saka DOH for everybody's use. Ganon. So, first and foremost, you have to check the expiry and packaging for any damages or tears. So, first thing you have to do, second thing you have to do after talking it out with your partner, you have to check the expiration date. Now, ito, 2024 yung expiration niya, so pwede siya gamitin. And then you have to inspect if merong mga tears, may mga butas, merong mga punit. Kasi if meron, don't use it na. Kasi baka damaged na siya, di ba? Doon parang pointless naman na gumamit ka ng condom na may butas pala. Ganon. So, next is, okay, it says here to open the packet carefully. So what you usually do is that you use these two fingers, ganito. Ayan. Ihawig nyo siya, parang you put the condom to one side, and then you get this side, and then you tear it. Para naman, when you're tearing, hindi madadala yung condom. Parang dito pa din siya sa side. So you open it carefully, ganyan. So your condom is open na. And hindi siya napunit, hindi siya nagkabutas, hindi siya nasira. Okay, next please. Now, you will get the condom like this. Yan. So you look for the unrolling side. So ito siya. Ayan. Yung unrolling side, ito yung side na pag nilagay mo siya sa ari ng lalaki, you will roll it down easily. Okay? So ito yung unrolling side niya. Ayan. Ayan siya. Next, please. Now, we usually perform the sandwich method. So before you put on the condom, you use a lubricant. Ito yung lubricant, it is advisable na water-based yung lubricant na gagamitin nyo kasi yung water-based, hindi siya masyadong nagre-react sa skin ng people, hindi magkakakos ng reaction, at the same time, hindi masisira yung material na ginagamit sa condom. So ito, lube first, lagyan mo ng lube yung ari ng lalaki, and then you put the condom, and then you put on the lube for further lubrication. Ganon, di ba? Syempre, pag hindi well lubricated, usually doon nagsa-start yung pagkaka-micro tears na susugat, ganon. Okay, so yung gagawin nyo is that you pinch the tip, itong tip ng condom, dito pupunta yung ejaculate ng lalaki. So you have to pinch it para lumabas yung air. Kasi pag may air dyan, yung possibility is baka puputok yung condom or mabubutasan. Ganon. Okay. So you pinch it and then, next Adi please. Ayan. Add a little lubricant on the penis, pinch to the top to remove the air, and then you roll it down. Ganyan. Sorry, wala akong model. Pero this would have been easier if meron akong model or something. Ayan. So you roll it down like this. So, kunwari, nandiyan na siya sa nandun na siya sa ari ng lalaki. So, what you have to do is, ganyan. And then, next please, next step na Adi. Ayan. Enjoy the intercourse, and regularly check if the condom is still in place. Kasi, baka ma-distract tayo, you're enjoying the intercourse, kasi hindi natin namalayan na wala na pala yung condom. Parang naiwan na siya pala sa loob, para magiging love rosy tayo, di ba? We don't want that. So, dapat nating tandaan na we have to check if the condom is still in place, if the condom has not yet been broken, parang hindi pa siya napunit, hindi pa siya nabutas, ganon. Next is, yan. Now, itapon siya, proper disposal. Kasi, mabuti naman na tama naman yung paggamit nyo, tama naman yung pag-open, pag-put on, pero mali pala yung proper disposal. So how do you dispose this? So after ejaculation, withdraw the penis while it's still erect. So yung yung point dito is kasi if hindi na siya erect, nagiging flaccid na siya, yung possibility na maiwan yung condom sa loob is very high kasi nga flaccid na siya. So you kukunin niyo yung penis while it's still erect and then point it downwards, pag ganito, and then you carefully remove the condom. Kukunin niyo siya. And then what you're going to do is you tie this. Parang you pull it down to check if there are holes, and then bababa niyo yung ejaculate ng lalaki, and then you wrap it. Ganito. Ayan. So when you wrap it, andito na yung laman sa loob and hindi siya nagsispill. Okay, kasi hindi naman pwede na itapon niyo lang na hindi niyo siya na-tie kasi yung possibility ng spillage is very high. And if nag-spill na siya, it can go anywhere, and you can imagine na yung risk of transmitting HIV is still there. Okay, next would be I6 na. So yung gagawin nyo is that you put it inside the packet. Huwag nyo muna itong itapon kasi paglalagyan nyo yun ng condom afterwards. And then you put it inside. Tapos, usually, if you have tissue paper, you wrap it, ganito, and then itapon nyo na. Okay? So, that's how you use, how you open, how you use, and how you dispose condoms. Ito, talk with your partner, open the packet carefully, find the unrolling side, sandwich method, lube condom lube, enjoy, and then properly throw it. Okay? So I hope na all of you remember how to use a condom next time, di ba? Okay, so next is,
The
next
next
please.
part is,
Ay, wala
okay,
pa. Ay, last slide na ba to?
ayan, tips ate.
Condom care. Okay, tips on condom care. Next. So, you have to store condoms away from excessive heat, light, moisture, and sharp objects. So, huwag niyo siyang ilagay sa areas na malapit sa direct sunlight, sa mainit na mga lugar, such as yung stove. Bawal yan kasi matutunaw yung, madadegrade yung yung material ng condom, and it's prone to breakage. And also, sabi nila, they put condoms in their wallets kasi pampaswerte daw, and para if ever kung saan pumunta, you just whip up the condom from your wallet, which is actually, we discourage it kasi yung wallet nyo, it's prone to friction and dropping. So if merong friction, may possibility na mabilis mapunit yung condom. Nasisira yung material. So, if you're going to put condoms in your wallet, don't use it, please. Pampaswerte lang siya. Pero huwag yung gamitin, okay? Ganon. So, next would be, I think this is, choose pre-lubricated condoms that come in wrappers and are packaged in a way that protect them from light. So, katulad ng condom na pinakita ko kanina, yung packaging niya is actually very solid na hindi madaling mag-penetrate yung light dito. And then it's also pre-lubricated na. Most condoms nowadays are pre-lubricated na. Okay? Next would be, do not use lubricants made with oil. Most oils damage condoms. Ito, so, huwag niyo gamitin yung petroleum jelly, lotion, or baby oil. Kung wala talagang water-based lubricants, your saliva will do as lubricant. Okay? I mean, yeah, it's actually one of the options. Tsaka huwag talaga kayong gumamit ng mga lotion kasi nasisira yung condoms doon. Okay, next please. Do not use condoms with torn or damaged packaging. So, na-explain ko naman to kanina kasi walang point na gumamit ka ng condom na sira naman pala yung packaging, tsaka butas naman pala siya, di ba? Okay, next please. Do not use condoms that are expired, brittle, dried out, or very sticky. So, yung risk dito is if expired na yung condoms, may probability na yung material ng condom na yun magka-cause ng irritation sa skin natin and sa ating reproductive parts. And also, if dried out na siya or very sticky, that would also mean na pangit yung quality ng condom, so hindi na siya reliable. And if brittle, syempre, hindi na siya magsi-stretch. So, pangit na yung quality niya. Okay? Next, please. Eto, never reuse a condom. So, sasabihin nyo na, ay, wala na kaming budget for condom. Baka pwedeng hugasan to, pwedeng itapon, pwedeng hugasan, saka suotin ulit. So, don't use that, please. Okay? Never use a condom. A condom is a one-time thing. So, disposable siya for a reason. Kasi dapat once lang siya ginamit. And also, another misconception is that, sasabihin ng tao na, ay, dalawang condoms yung gagamitin natin for further protection. Para sure na walang mangyaring mabutas o kapunit, ganun. Pero that's actually wrong. We discourage talaga using two condoms at the same time kasi it will cause more friction. If maraming friction, then it's prone to tear and mapupunit talaga yung condoms. So again, never use a condom and don't use two condoms at the same time. Only one. Okay, next please. Now, yung advantages nito, syempre it will help protect you and your partner from sexually transmitted infections. Kasama na dito yung HIV, HEPA, HSV, HPV. Ganon. Next, please. Ayan, you only need to use them when you have sex, so no advanced preparation needed and are suitable for unplanned sex. Now, if you're a girl and you're not on any birth control pills, you can easily use condoms. Okay, next. Next, please. Ayan. In most cases, there are no medical side effects from using condoms. So it's relatively safe talaga. Except na lang siguro if you're a person who is allergic to lubricants and yung material, yung latex na material ng condom. So that's an exception, but usually wala talagang side effects from using condoms. Okay, next please. Now, male condoms are easy to get a hold of and come in a variety of shapes, sizes, and flavors. We all know that, so it's one of the advantages of male condoms. Okay, next please. Correct and consistent use of condoms are a reliable method of preventing pregnancy. So, if you're just going to consistently use condoms and correctly use them, so ito talaga major method talaga siya preventing pregnancy, especially since it's affordable and it's accessible to everybody. Okay, next please. However, yung disadvantages niya is that some couples don't uh, find that using condoms interruptus decreases sensation. So, condoms interrupt sex. So, yung other couples would find na parang sinasabi nila that decreases sensation, pero let's also remember na mas mabuti ng safe, 'di ba? So, you have to use condoms every time talaga. Okay, condoms are very elastic but may tear if not used properly. So, ayun nga, yung from storage pa lang to usage. So, we have to remember how to take care of the condoms. Okay, next please. Some people may be allergic to latex, yeah, and plastic or spring size, so you can get condoms that are less likely to cause an allergic reaction. So that's why you have to talk to your partner before using condoms, kasi baka nga mayroon silang allergic tendencies. Okay, next please. Ayan. When using a male condom, the inserter has to pull out after he has ejaculated. So dapat erect pa yung penis before getting it out. Okay, next. Yeah, so this is us in TDB. So, ayan, so that ends our condom lineup. So, hopefully, you learned something about how to put on, dispose, and store condoms. So, I think that's it for my talk. So, I'll just, if you have any questions, please comment them down. I'll try to address them. And in the meantime, thank you again for having us in TDB. And I'll turn over the floor to Anne.
Thank you very much as well, Ate Cara. And now, thank you. And I hope that you've learned a lot from our discussion. And siguro, I think you're already all exhausted from all of the information overload no, na nagaganap. So right now, we're going to hear from a very special person, his experiences no, on what he underwent no, when he first acquired HIV. So let's hear it from Sir Nonoy.
Hello, good afternoon, everyone. I'm so sorry na hindi ko ma-open yung cam ko kasi andito ako sa shop namin. That's why na pasensya na po sa mga background noise na maririnig nyo kasi along the highway po. And again, everyone, good afternoon. And my name is Nonoy, a person living with HIV for almost 8 years. And I am AIDS survivor. It is hard for me to accept my situation, not only me, but also my family and my friends when they know my status. But I conquer all of those trials happen to me. Because for me, this is the way to change my behavior, my actions, disposition, and social behavior. All of those are my previous habits that I already changed. And some other people saying that if you're a person living with HIV, is a plague in our community, not only in our community, but also in our society. without knowing, and they did not know the real story behind on that, why they why we do that kind of thing. That's why even if I had this kind of disease, it made me a better person to other people. That's why I've been engaged on different organizations, attending a lots of trainings and seminars, local and internationals, to gain a knowledge to share to all of you guys here as what I've learned and experienced, that there has a persons like me that can be seen and recognized in our society. I'm just hoping that all of you here will help us to conquer this battle and to stop the stigma and discrimination, and to have a free society and community against, and to stop the stigma and discrimination. Someday, before I end this, please allow me to tell these three words, guys. Attitude. Our attitude is the most, and we should always be responsible for our attitude. And the second one is awareness. We should aware what kung ano mang ginagawa natin, we should responsible for that. And acceptance. The third one was acceptance. Acceptance is we need in our society today, because even if they know our status, they easy for them to judge. They did not accept, but some others know our status. They easily to accept us, but some others did not. That's why I encourage you to help us to take that three words. And the very important is to reach our goals, to have stigma and discrimination free society, and to end the stigma, and to have HIV free society and community. Hashtag know the science and stop the stigma. And please allow me to show my face. Here I am. If you have some questions, could you raise your hands or leave on the chat box? I'm willing to answer that. And I'm so sorry for the background because I'm here at my shop. And good afternoon to all of you, everyone.
Thank you very much, Kuya. And now we're actually going to proceed with the last part of our program, which is the new home mail. Please wait for a while.
Kung may mga tanong po kayo, feel free po, huwag kayong mahihiya. Willing po akong sumagot sa mga tanong ninyo.
Okay, so just send your questions na lang siguro sa ating Zoom chat if ever that you have questions. Okay. Nonetheless, you could also, if you have no questions, you could also send to our PLHIV brethren, no, persons living with HIV, your questions or like your message to them through our UO mail. So through our UO mail, you're going to you'll be able to directly send your messages of encouragement, your words of hope, no, to our PLHIV brethren. So I sent the Zoom link, or rather, I sent the Google Form link on our Zoom. So access nyo lang po.
So there you have it. Thank you so much for that insightful talk, Team Dugong Bughaw. I hope our audiences were able to widen their perspectives and on this matter. And partner, I have some list of what I have learned from TDBs. They addressed some words to remember on how to deal with PLHIV so that we can help to alleviate their feelings, and for them to know that we're here for them. So, first is to offer our support, reassure them that HIV and AIDS is manageable health condition, as what our guest speaker says or told us earlier, that there are medicines or that can treat them and help them to stay healthy. And lastly is to educate ourselves, educate yourselves by learning what really are the HIV and AIDS, how it is transmitted, how it is treated, so that we can help them to understand also other people that it is treatable. So how about you, partner? Do you have any learnings to share with our audiences?
Yes, partner, actually, I have some major takeaways from the talk din, no? I have come to realize that we, the youth, have the power to be involved in different campaigns and groups just like TBD, no, who help debunk stigma surrounding PLHIVs, and that we all have the capacity to help in our own little ways to raise awareness na din and show support for the proper dissemination of information regarding prevention and treatment of HIV and AIDS. But of course, our audience might have something na gusto na nilang malaman or maklarify. Kaya naman, let's now proceed to our question and answer. So partner, do we have any questions ba from our audiences sa ating Zoom chat box?
Okay, I will count 1 to 10 to wait for you if you have any questions to our guest speakers. 1, 2, 3, 4, 5, 6,
I'm sorry
7.
to interrupt, partner. I actually received an private
Okay,
message.
yes.
This is a question. So anyone from our speakers could answer this one.
Okay.
Magkaiba po ba ang HIV symptoms ng male and female? Again, magkaiba ba ang HIV symptoms ng male and female?
Okay, so I'll just answer this. So again, I was not able to explain earlier, pero 'di ba sabi ko yung manifestations ng HIV does not really depend on the gender of the person, but it depends on the immune system of the person. Since HIV attacks the immune system of the person, if you're already prone to diseases. So yung symptoms, walang exact symptoms ng HIV. The symptoms that you feel are the symptoms of the diseases that you acquire because mababa yung immune system mo. Now, for example, if you are a male and then may HIV ka and then bumaba yung immune system mo and then you acquire pneumonia, so yung symptoms na makukuha mo will be that of pneumonia, which includes coughing, fever, difficulty breathing, ganon. Now, for example, if you are a female and then may HIV ka, and then mababa yung immune system mo, and then you acquire diseases, skin diseases, such as may mga rashes or for example, oral thrush or your candidiasis. Ito yung symptoms na makikil mo will be based on the diseases that you acquire. Okay? So, thank you for that question. Medyo hindi lang talaga na-emphasize kanina, but yung symptoms na na-acquire ng person will depend on the diseases na na-acquire nila. So, if you have TB, you will have symptoms of TB because mababa nga yung immune system. That's all.
Thank you for that, Miss Cara. I believe you have answered the question. And to our audiences, please send in your questions if you still have. Zoom chat box is open for it. I think, partner, if there are no
No.
questions, no, let's proceed to
Yes.
asking our audiences of their takeaways, naman, personal takeaways from the talk. So, partner, please feel free to choose among the audiences.
So we're gonna ask some of our audiences. Sino ba, partner? Let me ask Miss wait. Um, Miss Kate Ann Bulyag. Hello? Hello,
Good
ma'am.
afternoon.
Good afternoon, Miss Kate Ann. May I ask, what are your takeaways on TDB's talk? And what do you think is the most significant part for you?
So, hello, good afternoon. First, I want to say thank you for everyone for stepping up and raising awareness about this matter. So, my biggest takeaway from you guys is that we should not think about being educated and raising awareness about HIV and AIDS should be limited only to our healthcare workers and those who were infected, because millions of people are currently dealing with this, and as they were called, PLHIV, persons living with HIV. And it's best to be knowledgeable because, again, coming from your team, education is the best way to break the stigma, to support and accept them, and also to decrease the discrimination from the persons living with HIV. Thank you.
Wow, that was really something, Mom, Miss Buliag. So thank you for that insightful contribution to the talk. So now, partner, I guess if there's ano pa ba, meron pa bang willing mag-share ng takeaway from the talk, please feel free. Okay, let me see now. From our audience's partner for a while. Let me ask Miss Giselle meets Itulat. So, hi Miss.
Hello, good afternoon.
Good afternoon po.
So
Can you share your major takeaways from the talk?
yes, from here po, I want to thank TDB for sharing this knowledge with us because for this knowledge po, we can help po, break the stigma and educate also other people about this kind of awareness because this is a sensitive matter. And I am very grateful that we have this opportunity, this webinar that we have conducted for us to share also our knowledge and also yun po, mag-help din po tayo stop the stigma behind HIV and AIDS po. Yun po. Thank you po.
Okay, thank you for that, Miss Jess. Actually, I agree with you, no. Sabi ko nga kanina that we also have to take part in debunking the stigma and help them in our even in the most little ways because together we can help build a brighter future for the PLHIVs. So ayan, there we have it, guys. We have heard some of our audience's learnings from today's discussion.
So, before we proceed to the awarding of certificates, let us first know what MedResults Medical Services and their product is, to be followed by a short commercial break. So, ladies and gentlemen, may we present to you MedResults Medical Services Philippine Workshop and Wedding Suppliers Association of the Philippines.
Been feeling left behind? Does the knowledge gap hinder your success? Worry no more because Philippine Workshops is here to serve you. We provide relevant and valuable webinars, trainings, and workshops nationwide that will help you make your own opportunities happen. For more details, please visit our Facebook page.
And there you have it. Now, let's proceed to the awarding ceremony. First of all, I would like to express my sincerest gratitude to Team Dugong Baghao for your participation and for providing us such a sensational talk. As a gesture of our gratitude, we present to you the Certificate of Appreciation. The certificate reads, partner, yeah, there you have
Okay.
it.
Okay. The certificate reads, the certificate is proudly presented to Ms. Cara Casañares in grateful recognition for sharing her valuable knowledge and expertise as a guest in HIV and AIDS awareness campaign with the theme, Hear Their Stories to Break the Stigma, given this second day of April 2022.
The same certificate is proudly presented to Mr. Adelmar Javier Jr. in grateful recognition for sharing his or her valuable knowledge and expertise as a guest in HIV/AIDS awareness campaign with the team Hear Their Stories to Break the Stigma, given the second day of April 2022.
Lastly, the same certificate reads, the certificate is presented to Mr. Nonoy in grateful recognition for sharing his valuable knowledge and expertise as a guest in HIV and AIDS awareness campaign with the theme Hear Their Stories to Break the Stigma, given this second day of April 2022. And also to our Zoom participants, you will also receive an e-certificate as a gesture of our gratitude for participating in today's webinar. You can also access the evaluation form in our chat box for confirmation. The certificate reads, the certificate is proudly presented to the participants as they actively participated in HIV and AIDS awareness campaign with the theme, Hear Their Stories to Break the Stigma, given the second day of April 2022.
And of course, we would like to promote the MedResults Medical Services First Aid Kits. We all know that first aid kits is an essential in every household and workplace. Kaya naman, MedResults offers their product for a very affordable price of 249 pesos. And with that price, you already have the following items in your kit: one masking tape, two povidone iodine pads, one tweezers, one scissor, three alcohol pads, one triangular bandage, one emergency blanket, two rolls bandage with a size of 6 centimeter times 4.5 meters, 10 pieces cotton buds, 10 pieces band-aids, 5 pieces sterile gauze pads, 5 safety pins, one survival fire starter, and one multi-tool. If you wish to avail the MedResults First Aid Kit, please coordinate or contact MedResults Medical Services on their Facebook page or email at medresultsph@gmail.com for inquiries.
Also, we would like to thank the following sponsors for today's MedResults webinar. Wedding Supplier Association of the Philippines, Philippine Workshop, Accounting Portal Philippines, Alaban Reality Estate Directory, Mobile Palengke, Philippine Travel Expo, Philippine Virtual Expo, Online Pasalubong Center, and Philippine Hotels Directory.
One more thing, partner, no? Let me promote the Wedding Suppliers Association of the Philippines Incorporated's membership. Be a proud member. If you're still not a member, what are you waiting for? Visit their main Facebook page and direct message them for inquiries.
Ayan, we're almost done with our program today. But before we officially end, we would like to request everyone to stay for a while para sa ating photo op. Kaya naman, I'm also requesting everyone to turn on your cameras for our picture taking. So tech team, please take it away. Okay.
So let's give our brightest smiles para naman maramdaman natin that this event is truly insightful. All right. I guess that's it. But before we end our program, I would like to call Miss Mary Ashley Faustino, the brand head of MedResults Medical Services, for her closing remarks. Let's give her a virtual round of applause.
Thank you, Miss Shaina and Miss Arish. First of all, I would like to thank all of our participants here in Zoom meeting and our Facebook viewers who actively participated in today's webinar. To Team Dugong Bukhao, thank you for taking time from your busy schedule to be our guest speaker at this webinar. This event was a huge success, all thanks to your enlightening stories, insights, and inspiring words. Your lecture brought us new knowledge and inspired all of us. Thank you as well to my team, MedResults Medical Services, the Philippine Workshops, and Wedding Suppliers Association of the Philippines team who helped us to make this webinar possible. And lastly, to our country manager, Mr. TJ Yuson, thank you for giving us this great opportunity and for trusting our team to conduct this event. Before I end my message, I would like to share a quote by Ralph Fiennes saying, education, awareness, and prevention are the key, but stigmatization and exclusion is what makes people suffer most. On behalf of MedResults Medical Services, Wedding Suppliers Association of the Philippines, and Philippine Workshops, we would like to give you our sincerest gratitude. I'm ending this closing remarks to quote what Mr. Nonoy have said earlier, acceptance is what we need in our society. Thank you and have a good weekend, everyone.
All right. So now that we have come to the end of our program, first of all, I would like to applaud Mr. Nonoy's courage to speak up and share his story. And also, we would like to thank everyone who has joined us here today. So, may we all keep in mind that the risk to HIV infection depends on the behavior, not the identity of the person, quoted to Miss Cara earlier. Hence, together with TBD, Team Bugong Bughao, let's know the science and stop the stigma. We hope that you all enjoyed this event. Once again, thank you so much and have a great day.